Meanwhile, the Delhi government has now ordered 117 nursing homes and private hospitals that have a strength of more than 50 beds to reserve at least 20% of their total bed strength for COVID patients. In fact, those hospitals that have a bed strength of less than 50 beds, as well as nursing homes, they will be declared as COVID nursing homes. Now, this move comes amid the rising cases of coronavirus in the national capital, as Ayushman was also just telling us about, and over 70% of COVID beds in private hospitals are in fact already occupied. Ayushman, so this is yet another, way of trying to sort of increase the number of beds. We saw earlier as well that the Delhi government had asked, some of the private hospitals to reserve 20% of beds. But now this is going the next step, including nursing homes as well, to ensure that there are enough number of beds in Delhi.
Yes, Avni. In fact, their management will be very much crucial because if you make them COVID-dedicated facility center, there'll be different kind of situation. If you talk about these hospitals who have 1 to 50 bed capacity, now that has also been taken in fold. And if you remember, Avni, given the bed strength number was to be increased, the Delhi government did not stop on 20%, but they also increased the cap. They told the private hospitals that they need to dedicate more beds to COVID-dedicated facilities, and for that reason only there were several private hospitals who were told that more than 20% of the bed will be added. Now, yesterday night there was another decision taken in which all those nursing homes which have 1 to 50 bed capacity, even they have been included in the COVID-dedicated facility for providing treatment to people who are suffering from COVID infection. Currently, the all-out strength is on the improvement of number of beds. If you remember, Avni, the LG talked about converting the stadiums into makeshift hospitals where oxygenated bed will be available. Now we are seeing the tweet of Union Home Minister where he talks about the railway coaches, 8,000 additional beds. So all in all, the focus is, because the expectation is that the rise will definitely be there. The numbers will increase, and in those circumstances, the only thing that will help is augmenting the health infrastructure. Of course, this was the reason why the lockdown was there. But currently, if you see all these meetings which are taking place, they are only for one reason, is to how we can increase the number of beds in the national capital, and that is why you are seeing even the nursing homes who are having only 50 beds capacity, they are also being taken in fold as to how they can treat the COVID patients.
Absolutely, Ayushman. Thanks so much for joining us with all of those details.